Well, good afternoon, everyone, and thank you all so much for being with us today. I am Dan Carey, Secretary of Health and Human Resources here in the Commonwealth. Good afternoon. Thank you all for being here in recognition of National Immunization Awareness Month. And a special thank you goes out to Dr. Art Kellerman and the VCU Health team and the Children's Hospital of Richmond. We also want to thank Old Dominion University, VCU University, and Radford University for being here today. And also thank you so much to the Immunize Virginia Coalition that helped organize this event, and so very important. I'll begin simply. We need to get the word out. We need your help in spreading the word. We know that Virginia families are falling behind in their immunizations because so much else has been going on. But with children returning to in-person learning and play, it's important to make sure that they're getting their regular checkups and they're getting their immunizations and that they're on track and up to date. We can't protect our children from the falls they can have on the playgrounds. That's part of growing up. But we can protect them from diseases like mumps and measles and HPV. And it's so very important that we get the word out and we get all of our children up to date, up to speed on all of the required vaccinations. And to raise awareness today, I am joined by my boss, Governor Ralph Northam. As the nation's only physician governor, he has spent years as a practicing pediatrician, and I can't imagine a more qualified person and impassioned person about this topic to share some thoughts with you today. Governor Northam.
Well, good afternoon. It is good to be here, and first of all, thanks to the mascots from representing the Highlanders and the Rams and the Monarchs. And I guess just a quick question. I know we're starting back up at schools and colleges. Which one of you all is going to have the best team this year? What do you think? Yeah. So anyway, please give them a round of applause for being here and for having their spirit. Dan, thank you, Dr. Carey, for your introduction and your leadership, and it's great to have Dr. Avula here. Danny, it's been a long few months, but appreciate all your work, and I know we have Dr. Tiffany Kimbrough. Thank you so much. It's good to see another fellow pediatrician, and Nakisha White, and we'll be hearing from all of you, but thanks for taking time out of your busy schedules to be with us today. I also wanted to thank Dr. Kellerman. Is Art still with us? Art, thank you for a couple things. One, for your hospitality this afternoon and letting us be here to really get out the importance of vaccines for our children. But I want to pass on to you and to all the other healthcare providers what you all have done over the last 18 months. You have literally been on the front lines day in, day out. I know it is very, very difficult work, but you've taken wonderful care of our fellow Virginians. And so on behalf of Virginia, to all of you here at VCU and to all of our other healthcare facilities across the Commonwealth, I sincerely say thank you. This has no doubt been a difficult year for all of us, not only in Virginia, but in this country and really around the world. And just a couple facts I would share about COVID-19. We have lost close to 12,000 of our fellow Virginians to COVID-19. We've had approximately 750,000 cases of COVID here in the Commonwealth. We had over 1.6 million Virginians lose their jobs and file for unemployment. People have lost their businesses. Some of them have lost the roofs over their heads. And so the point I want to make is while we have all been very busy and really engulfed with COVID-19, one of the most difficult decisions that we had to make at the state level was to go to virtual learning last year for our students. And so I think a lot of families really thought with their children at home, you know, perhaps they didn't need to get vaccinated, or they were just too busy, or they were worried about getting out into the public and going to their provider's office. But I just wanted to emphasize, and I think Dr. Carey, you made this point as well, that vaccines save lives. They also have really been able to not only control but also eradicate in some cases some of the illnesses that children get. And I've got a little bit of gray hair on my head, but I just thought I would tell you all a personal story. When I was a pediatrician back in the mid-'80s, we had 3 very prominent types of meningitis. And then immunizations came out for those types of meningitis, for the pathogens that cause those, and all of a sudden we stopped seeing those. Every now and then they would pop up. But Dr. Carey mentioned things like polio and measles, mumps, rubella, pertussis, which we call the whooping cough, diphtheria, tetanus. Everybody has heard of tetanus. And now immunizations for hepatitis A, human papillomavirus, meningococcemia, rotavirus. I mean, all of these illnesses in children and even in older individuals can be devastating. And so it is so important for our families to go in and make sure their children are up to date on their vaccinations. And you know, as a pediatrician, and Dr. Kimbrough, I'm sure you would agree with this, all of our children need access to a primary care provider. And we have this back to school drive. We want everybody to be able to go see their provider, make sure their shots are up to date, make sure their dental needs are taken care of, and make sure that they're healthy and ready to learn. And so just in closing, I also want to make a point about our COVID-19. As I said earlier, the numbers are real. Today, we had about 3,500 new cases of COVID-19, of mainly the Delta variant in Virginia. We recorded another 15 deaths. We're averaging 15 to 20 deaths a day. The hospitalizations and the deaths, for the most part, are avoidable. And I just encourage all of you to be part of the solution. If you haven't already received your vaccine, and we have 3 very effective and safe vaccines, the Pfizer, the Moderna, and the J&J. If you haven't received a shot, roll up your sleeve, do the right thing, not only for yourselves, but for your family and all of those around you, and go in and get that shot. So thanks for being here today. And I think, Dr. Avula, were you going to follow me? Please welcome another fellow pediatrician. And Danny has really been in charge of our vaccination program and done an amazing job. But Danny, thanks for all of your work, and welcome to the podium, Dr. Danny Avula.
Good afternoon, everybody. It's warm, and I'll be quick. As a pediatrician and a public health doc, I'm just really pleased to have been invited here to be a cheerleader for Immunization Awareness Month. It's a huge need, especially right now. The last year and a half of facing COVID has really impacted our vaccination rates for other things than COVID. And so we, through 2020, saw a significant decline in vaccination for other preventable diseases. Thankfully, the great work of colleagues like Dr. Kimbrough, the pediatricians here at the Children's Hospital of Richmond, and our pediatrician and family physician colleagues across the state, we've largely caught up in the 0 to 24 age group, but are still facing severe deficits in our school-age children and our adolescents. And so as kids get ready to go back to school, we've got enough in our hands with COVID, and so we really are asking and urging parents to do your homework, talk to your providers, and get kids caught up. Look at the information that's coming through in schools, and know that it's more important than ever to get our kids vaccinated for any number of vaccine-preventable diseases, because in the midst of all this, we don't need another mumps or measles outbreak to weigh down the public health and healthcare system any more than it has. I would also say that the COVID vaccine, as the governor just mentioned, is here. And while we don't have an approved vaccine for younger children yet, it's coming. We do anticipate that we will see that in the next 1 to 2 months. And at this point, all the recommendations for kids 12 and above have been that COVID vaccine can be co-administered with other vaccines. And so we'd really encourage you, as you're bringing your children in to get vaccinated for these other diseases, to also get vaccinated for COVID if that has not already happened. So really appreciate you all coming out here today, and everybody who's listening at home, more important than ever to get our kids caught up. Thanks so much.
Hello, I'm Tiffany Kimbrough. I'm a general pediatrician here at the Children's Hospital of Richmond. And as you've heard, August is National Immunization Awareness Month. And as a pediatrician and also a mom of 2 little people, I'm really honored to be speaking to you today for this critical message. Vaccines are one of our most important tools at helping kids to be safe, letting kids be kids and have a healthy, happy life. Through vaccination, as you've heard, we can prevent 16 different preventable illnesses like measles, mumps, rubella, meningitis, whooping cough, and even cancer. I still get amazed that we can prevent cancer that's caused by human papillomavirus. We have a vaccine for cancer. Vaccines have come a long way since they first started. If you don't know, a little bit of trivia, back in 1796, Edward Jenner was taking the fluid from infected blisters from folks with smallpox and injecting that fluid into uninfected individuals, and that's how vaccines got started. So we've come a long way. Vaccines are much more sophisticated now and a little less gross than when we first began. But we pediatricians feel really comfortable talking to your family about vaccines. We know there's a lot of concerns out there. Social media can have a lot of information that may be hard to parse through. And so one of the consequences that we've seen not only from the COVID pandemic is just a lot of mistrust, and we are ready and willing to talk through all of those concerns in the office. Some vaccines prevent common illnesses like whooping cough and chickenpox. Other vaccines are for more rare diseases, luckily like measles, but we need to keep getting vaccinated so we can prevent outbreaks like Dr. Avula said. Most vaccines are more than 90% effective, which is amazing. That means that if your child gets vaccinated, you can basically count on them being protected. But it's not only about us, it's about keeping our community safe, because we know not everyone in the community is able to get vaccinated. So that herd immunity is really important, that we not only do our part for ourselves, but for the neighborhoods that we live. If you think your child may be behind on vaccines, please reach out to your child's pediatrician or family practice provider. We have been providing safe health care throughout the pandemic, and we're ready and excited to see your family back in the office again. If you do have any questions around vaccines, please just trust your team to be ready and willing to answer those, to hear your concerns, whether you're worried about pain from the injection site or something that you've come across on social media. And as part of National Immunization Awareness Month, I myself have a kindergartner getting ready to start in Henrico Public Schools. So just making sure with your doctor that your child is ready to go back to school and have a safe, healthy year. It's been a long year for our kids, and they're really excited to be back with their friends. Next up, we have Nikisha White from Richmond Public Schools, here to talk to us more.
Good afternoon. I'm Nikisha White, Coordinator of School Health Services for Richmond Public Schools. School health practice is comprehensively aligned with public health, as both entities are heavily vested in promoting health and wellness within our communities. Immunizations are essential to the well-being of our students. Immunizations are one of the greatest achievements in public health. And it is imperative now, in these unprecedented times, that students are up to date with childhood immunizations. Immunizations are absolutely essential in the prevention of serious illness and disease. As school nurses, we often find ourselves in pivotal positions to provide education and guidance to our families on the benefits of immunizations. One of the joys of my role is being able to serve as the liaison between our families and community-based providers. and engage in care coordination to enhance health-related outcomes for our students. Immunizations are significant tools in keeping our students in school healthy and ready to learn. Thank you very much.
So I'd like to welcome Rachel Epstein here from Immunize Virginia, and thank you for all the wonderful work that you've done. And this is a proclamation, and this makes us aware that that August of 2021 is immunization month in the Commonwealth of Virginia. And I've been in politics long enough to know that it's not a good idea to read the entire proclamation. But that's what it says. And Rachel, I just wanted to, on behalf of Virginia, say thank you for all of your great work. And just again, thanks for being here. Let's get the word out to all of our families, all of our children across Virginia. It's back to school. We want our children to be back in school safely and responsibly, and we can do that. But go out there, see your provider, and make sure that all of your immunizations are up to date. So Rachel, thank you, and happy August Immunization Month in the Commonwealth of Virginia. Thank you so much.
Thank you.
Yes.
Thank you so much.
Yeah. There we go. Yes, yes.
All right, well done. Well done.
Thumbs up at the end of January when I came to my wife and I bought a house right behind